Every day, we at the San Francisco Department of Public Health work to control and prevent infectious diseases.
Pandemic flu is one type of infectious disease. It could infect millions of people and cause a public health disaster. This video will tell you about pandemic flu, how it could affect our community, and how to prepare for it. As a city employee, you are considered a disaster service worker. You will be called on to respond during an emergency. Pandemic flu will be a unique type of disaster. For this reason, this video was developed to help us and our city agencies prepare. By watching this video, you will learn about pandemic flu, how it could affect our community, how we can control the spread of pandemic flu, and what we can do to prepare.
We have a special role as disaster service workers, and by planning and preparing now, we can protect ourselves and our families and help our communities survive a pandemic flu. Thank you for taking the time to listen and prepare.
Did you know that there are different types of flu? For example, seasonal flu, bird flu, and pandemic flu. All of these types of flus, sometimes called influenza, are infectious diseases of the respiratory or breathing system caused by a virus, the influenza virus. Seasonal flu is a common infectious disease that you may already know a lot about. You've probably had the flu before. Because people usually catch it in the winter, we sometimes call it seasonal flu. Seasonal flu typically causes a fever, headache, sore throat, cough, and muscle aches. Most people have mild symptoms. However, each year in the US, 200,000 people are hospitalized and 36,000 people die. Usually these people are very young, chronically ill, or elderly. The flu is spread from one person to another through tiny wet drops caused by coughing, sneezing, or talking. A person can be infected by breathing in those tiny wet drops or by touching something that was recently contaminated with the flu virus, and then touching their mouth, nose, or eyes. Almost everyone will catch the flu at some point in their life. Some people may even catch it many times in their lifetime. This is because the flu changes or mutates a little bit every year. So even if you get it once, when you are exposed to a slightly different flu virus, you can get sick again. Each year, scientists monitor the flu around the world and make a vaccine that specifically matches the viruses that are presently spreading. This means that you can help protect yourself by getting a flu shot every fall. You might have also heard about bird flu or avian flu and wondered, is it different? Yes, birds get their own type of flu. Although flu infections in birds are common, experts are worried about one type of bird flu called H5N1, which has sickened and killed millions of birds around the world. People can get infected with bird flu, but it happens very rarely. The few people who have been infected by H5N1 bird flu usually had very close contact with infected birds. Experts are worried that this bird flu virus could change or mutate into a new type of human flu. If a new human flu virus emerges, either from bird flu or any other type of animal flu, and causes severe disease and spreads easily, it could infect people around the world and result in great harm. This would be pandemic flu. Pandemic flu could cause many people to get sick, possibly more than 30% of our population. And even though the symptoms may be similar to seasonal flu, experts predict that the disease will be more deadly. We have experienced pandemic flus in the past. In fact, 3 occurred this century. In 1918, a severe pandemic hit the world. If this pandemic happened today, over 1.8 million people would die in the United States, most of whom would be healthy young adults. There were also mild flu pandemics in 1957 and 1968.
Experts believe that another pandemic is very likely. Just like with earthquakes, we do not know exactly when a flu pandemic will occur or how severe it will be. For the next pandemic flu, we would like everyone to have the best possible outcome. We can improve our chances by preparing now.
Many government agencies, business leaders, and others are taking steps to prepare for pandemic flu, including San Francisco. How might a pandemic flu affect San Francisco? A pandemic flu could start at any time in any place, including California. Experts regularly monitor flu activity across the world. We hope that because of this close surveillance, we will have some warning before a pandemic flu comes to San Francisco. However, once started, a pandemic flu could travel to our community quickly, perhaps within days or months. A pandemic flu could last many months, and perhaps 30% or more of San Franciscans would be sick at some time. Chances are that we would not have a vaccine right away, and our medicines might not be effective. Hospitals and clinics might be overwhelmed. Some people might need to receive care at home from friends and family members. Businesses and city agencies might have to cut back their services because many employees would be out sick. These organizations would need to focus on essential services. For example, trash might still be picked up, but landscaping services such as lawn mowing and pulling weeds may be reduced. There may be shortages of products that we normally get easily. During a pandemic, the San Francisco government would activate emergency plans to respond and to maintain essential services. City leaders would coordinate activities between government agencies, hospitals, businesses, community groups, and other partners. Reliable San Francisco-specific information would be issued. This information would include advice on how to protect ourselves, our family members, and our community. All of us who are disaster service workers would need to help respond and keep the city running. Our efforts as disaster service workers are absolutely essential. We will all be expected to follow our department's instructions for reporting to work once we have determined that our families are safe. The idea of pandemic flu in San Francisco is scary, but public health experts at the federal, state, and local levels are preparing to respond as effectively as possible. If and when it arrives, we expect San Francisco healthcare professionals, city employees, and the public to meet the challenge. The planning and preparations we do now will make those efforts more successful. Can we stop pandemic flu from spreading in our community? No, but we can limit the spread of pandemic flu so less people get sick. There are steps that the city can do to protect our community and things that we as individuals can do. With the flu, it's hard to tell who is contagious because people can spread the flu even before they appear sick. The San Francisco government may take steps to slow and limit the spread of disease during a pandemic flu. Because the flu can spread quickly in crowded settings, San Francisco may cancel large gatherings like sporting events and concerts or dismiss students from school. When in public, people may be asked to wear face masks, especially when in crowded settings like on buses and trains. Individuals can take some basic steps to prevent spreading our flu germs, remove flu germs in our environment, and prevent becoming infected with the flu. These strategies aren't just for pandemic flu, they are healthy habits that you can begin using today. These healthy habits will also reduce the spread of seasonal flu and many other common infectious diseases. During a pandemic flu, you can prevent spreading your germs by staying home when you're sick, always practicing good coughing and sneezing habits, and wearing a face mask when in public, especially if you are feeling sick. Good coughing and sneezing habits mean covering your nose and mouth with a tissue when coughing or sneezing, and then throwing used tissues in a trash can and then washing your hands, or by using your upper arm if you don't have a tissue when you cough or sneeze. And if you're wearing a short sleeve shirt, use the inside. Coughing or sneezing into your upper arm is the best way to prevent spreading your germs when you don't have a tissue. When you cough or sneeze on your hands carry and spread these germs when you touch a door handle, telephone, escalator rail, subway pole, or computer keyboard. The next person who touches these areas might pick up those germs and get sick if they don't clean their hands before touching their eyes, nose, or mouth. This is how seasonal flu and other respiratory diseases spread, so it is a good idea to start practicing these healthy habits now to prevent spreading your germs. Let's take a look at a few coughers and see if they know the right technique. Watch as our judges rate the following coughs. Here we have participant number 1. Oh, right in their hands. I'd give that a 0 or even a negative number if I could. Let's see if participant number 2 does any better. Well, they didn't cough into their hands this time, thankfully, but they still got their germs in the air like that. I'd give that a 0 again. Here we have participant number 3. This person did a much better job. We're getting there, folks. Coughing like that on their wrist didn't get germs in their palms, but still got germs on their hands. I'd give that a 3. Let's watch participant number 4. Now that's how it's done. Sometimes you just don't have a tissue, and coughing or sneezing in your upper arm like that works just as well. Remember to always cough into your arm, not in your hands. Practicing these habits now is important and will be especially critical in slowing down the spread of pandemic flu. There are other ways to prevent spreading your germs. You may need to wear a face mask to protect yourself and others during a pandemic flu. Surgical masks are one kind of mask. They are designed to protect other people from your germs. Surgical masks come in different colors and models. Putting on a surgical mask is easy. Make sure to follow these steps to avoid getting germs on your mask. Clean your hands with soap and water or hand sanitizer. Make sure you know which side of the mask to put near your mouth. Usually the white side goes towards your mouth and the color side faces outwards. Hold the mask by the ear loops with the stiff edge on the top to be placed against your nose. Place a loop over each ear, then pinch or mold the stiff edge to the shape of your nose. Finally, pull the bottom of the mask over your mouth and chin. Anytime you need to remove your mask, first clean your hands with soap and water or hand sanitizer. Then hold both of the ear loops and gently lift and remove the mask away from your face. When it is off, throw the mask in the trash. And finally, clean your hands again. Since viruses are too small to see, we don't always know what surfaces are contaminated. So to remove flu germs in your environment, you should disinfect or clean frequently touched areas and objects. For example, you'll want to make sure to clean countertops, water faucets, doorknobs, tables, telephones, and other items that people touch a lot. Although we don't have control over how fast pandemic flu spreads or how severe it will be, we can have some control over protecting ourselves. To prevent becoming infected, you should limit the close contact you have with people. For example, you should avoid large group gatherings, or when you must be with other people, make sure to stay several feet away and wear a mask. You should not share personal items like toothbrushes, and make sure you wash your hands frequently. Don't touch your nose, mouth, or eyes with unwashed hands. One of the best ways to protect yourself all of the time, but especially during a pandemic flu, is to clean your hands. But you must do so properly. There are 2 ways to clean your hands: by washing them and by using hand sanitizer if your hands don't look dirty. This kills germs and reduces your risk of spreading or catching the flu virus. It's easy to wash your hands the right way. First, wet your hands with warm water. Add soap and rub your hands together for 20 seconds. 20 seconds is how long it takes to sing Happy Birthday 2 times. Make sure to scrub all the surfaces of your hands and fingers, including the fingernails. If you wear a ring, wash around it and work it up and down between your finger joints. Rinse thoroughly. Dry your hands with a paper towel. Turn off the faucet with a paper towel and throw it away. Moisturize with lotion if your hands feel dry. Just remember the 3 S's for washing your hands. 20 seconds with soap and wash all surfaces, front, back, and between fingers. If you are unable to wash with soap and water and your hands do not look dirty, you can use hand sanitizer. You will need to use an alcohol-based hand sanitizer or cleaner with an alcohol content of at least 60%. The alcohol content is usually listed on the back of the container. Use hand sanitizer when hands do not look dirty. Use enough hand sanitizer for both hands. Rub between fingers, under fingernails, around joints, and the tops and palms of your hands until they feel dry. If your hands dry before 10 seconds, you did not use enough hand sanitizer. If this happens, start over with more hand sanitizer. Whether you wash your hands with soap and water or use hand sanitizer, when you clean your hands is as important as how you clean them. It is important to wash or clean your hands several times throughout the day, including before or after, sneezing or blowing your nose, being in contact with someone who is sick, using the bathroom, preparing and eating food, treating a cut or wound, changing a diaper, or helping a child or another person use the bathroom. Make sure you clean your hands many times throughout the day, following the proper steps. This will kill germs and reduce your risk of spreading or catching the flu virus. You should learn and practice all of these healthy habits. Start today and teach them to your children, family, and friends. While none of these strategies alone will keep us from getting sick, we do know that if we layer these steps, we have a better chance of staying healthy and reducing the spread of disease in our community. This is similar to a block of Swiss cheese. Individual slices have holes, but with more slices or layers, the holes disappear. It is important to have accurate and up-to-date information in any type of emergency. Rumors and incorrect information spread quickly in scary situations like emergencies. During a pandemic flu, reliable San Francisco-specific information will be provided by the city. You can check the San Francisco Department of Public Health's website now for fact sheets on seasonal flu, bird flu, and pandemic flu. Here you'll find recommendations on how to prepare for a pandemic flu and tips for stopping the spread of disease. 311 is a number that you can call anytime to get information about the San Francisco government. During an emergency, 311 will also have information about the incident and San Francisco's response. Customer service representatives are available 24 hours a day. Press releases and press conferences may be broadcast by local TV and radio stations. Certain radio stations are set up to receive late-breaking emergency information. Your city agency would also be an important source of information during a pandemic flu. It is important to find out now how your employer will share information with you during any type of emergency. Avoid being misled by rumors and false reports. Use these sources to stay up to date with reliable San Francisco-specific information to help you and your family be safe during a pandemic flu.
You don't have to wait until a pandemic flu hits before you start protecting yourself. Many things can be done now to help you prepare for a pandemic flu.
Begin practicing healthy habits that reduce the spread of germs. Every year, get a seasonal flu shot. While it may not protect you fully from pandemic flu, some experts think it may help. Learn about pandemic flu. Make note of important sources of emergency information. Talk to your supervisor to make sure that you know how to report to work during an emergency. For any type of emergency, it is advisable to have a general emergency kit with supplies to help you through the first 72 hours of a disaster. However, for a pandemic flu, which may last several months, you should add some items to your general emergency kit. These include extra supplies of non-perishable food and water, extra supplies of prescription and over-the-counter medicines, soap and hand sanitizer, face masks. In your kit, make sure to include not only supplies, but information about your family, like their medical conditions, prescribed medicines, and allergies. A complete list of items to include in your emergency and pandemic flu kit can be found on the San Francisco Health Department's website at www.sfdph.org/CDCP. This is just a basic list of things that you should include in your pandemic flu emergency kit. Make sure to include other items important to you and your family. Store the kit somewhere safe and easy to reach.
Although we can't completely avoid a pandemic, we can take steps to be ready for it. Thank you for taking the time to learn about pandemic flu. Because public health experts believe that pandemic flu will happen eventually, we believe it is important for you to be informed and be ready to respond. While the idea of a pandemic flu can be a little scary, when they have happened before, communities got through them together.
In San Francisco and across the country, government and business leaders are taking steps to get ready. We hope that you will too. Please use the information in this video to prepare yourself and begin practicing healthy habits.
We know that as a community, San Francisco cares enough to prepare and will work together during a flu pandemic. Thank you.